Hello, classmates. How you doing? So my name is Shin De Kong, and then today I'll go over OPA and NPA. OPA stands for oropharyngeal airway, and then NPA stands for nasopharyngeal airway. Okay, so please remember how to measure what's a contraindication and indication of the OPA. Okay, so when you do when we give them OPA, patient has to be unconscious. Why? Because if the patient has a gag reflex, you get in big trouble. So you have to use the suction. Okay? So I will show you how to measure NPA. So NPA measure from the earlobe to edge of the mouth. Like this. There's a three way to put in the OPA, okay? Put in like a 90-degree as go inside the mouth and then turn it and then push down. Okay, there was a 90-degree, and then there's a second, you can use 180-degree. Like this, as inside, go inside and then turn it and then push down. This mannequin doesn't have a big mouth, I cannot put it all the way. So I'll show you one more time, it's 90-degree. Go 90 this way and turn as go inside the mouth, turn it and push it down. And then 180 degrees like this, like that, and then push in the mouth as go inside and then turn and then push down. Okay, there's a third way to do it. You can use the tongue depressor. When you go to doctor's office, when you have a pain in your neck, so they use a tongue depressor, like a little bamboo stick, put in the mouth, and then push down, and then just like this, just put it in the mouth, and then give it the OPA, and then put in the OPA, and then you can give them to PPV. PPV stands for positive pressure ventilation. Don't forget, if the patient is not suspected of spinal injury, you can use head tilted chin lift, like this, okay? Head tilted chin lift. Do you see the chest rising down? That is a PPV, positive pressure ventilation, okay? So one more time. So when you use the NPA or OPA is a contraindication. When patient is conscious, we do not use OPA to the patient. Patient has to be unconscious. Okay. Move on to the NPA. NPA stands for nasopharyngeal airway. Nasopharyngeal airway. Okay. This NPA, we can use the patient is conscious or unconscious, both. Okay. So you can use it. And then the contraindication of NPA, if a patient has a facial trauma or head injury, we do not use NPA. Why? When you put in the NPA through the nose, what's going to happen? You call ICP, intracranial pressure. So we increasing the ICP, intracranial pressure, so it can cause a lot of problems. So contraindication, two things. No facial trauma and the head injury, okay? So when you use the NPA, it's the same thing. When you measure from earlobe to tip of the nose, okay? Tip of the nose, earlobe like this, and then when you see the nose, before that we have to use water-soluble lubricant, okay? Water-soluble lubricant. Squeeze it on your palm, dip it a little bit like here, and then put in the nose, like this. And then go inside. As you go in, you twist it, and then push down. So right here, and then you put it in, lift a little bit like this, and then push down. Okay, that is an NPA. Please remember, always ask a EMT paramedic test. Okay, how do you measure? what's the contraindication of the NPA, and then what is indication of the NPA. So patient has conscious or unconscious, you can use it. And then how to measure, you look the tip of the nose, and then always use a water soluble lubricant, top, and then put in the nose, okay? So, and then after that, so I told you PPV, what does it stand for PPV? Positive pressure ventilation. So always remember, CE clamps, C, your middle ring and the pinky finger, grab a jaw, mandible, right? There's a mandible, grab it, and then squeeze it, and then give them oxygen, okay? Every 5 to 6 seconds, please remember, every 5 to 6 seconds, okay, watch me. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, like this, okay? This is the NPA and OPA, okay? See you later.